early in the operation, they did almost lose baby David.
When you saw your kid, your baby, is fighting every day for his life, he tried to tell me, please don't stop. Please don't be sad because I am fighting. We never give up. We never give up.
I'm probably in the best shape I've ever been in my entire life. I run probably between 30 and 40 miles a week. I bike. I stay fit. I go to the gym. I watch what I eat.
So Brett Troyer was surprised when his doctor called to give him his test results.
Because 2 came back positive because you have prostate cancer. And the first words out of my mouth were, "You're kidding me." Because I didn't expect it at 41. Cancer does not discriminate. It doesn't care who you are. It doesn't care how old you are.
So Brett began researching the latest in prostate treatment and volunteered to be part of a high-profile procedure.
Obviously, robotic in the United States these days, it's the way to go. 75% of all patients who have prostate cancer surgery have it done robotically.
Dr. Vipul Patel from Florida Hospital's Celebration is one of the world's leading robotic surgeons. Today, the procedure he will perform on Brett Troyer will be viewed by 500 physicians at a conference center in Orlando and by doctors in Italy and Korea.
I'm outside the operating room. My console is now outside. The team is inside, the patient's there. We have all our doctors, all our nurses. I find it much more relaxing, much more efficient to actually be outside. The key is really having better vision and having more dexterity in confined spaces. That was the problem with open surgery. It was very difficult to see the prostate. It was a bloody field, and it's very difficult to save the nerves responsible for continence, sexual function, and cure the cancer.
So that was the question. Are we going to be replaced by these robots? Maybe. Look what happened with the military. And today we have 9,000 robots on the battlefield.
A robotic surgery unit is a several $million commitment up front. We think very hard when it comes to a new technology. It has to have the possibility of changing healthcare forever to make it safer, simpler, and less expensive.
And you're beginning to see the cubovesical or cuboprosthetic ligament come into view right there, just to the right of the midline.
Here at Celebration, we train over 6,000 physicians a year in minimally invasive technique. When you have the experts here who love to teach and love to impart their knowledge, we lose nothing by sharing that. We've actually gained it.
And our job as surgeons is to continue to refine this technique. And I can tell you, 3,000 cases in, I'm still learning.
And I think that's a brilliant, brilliant display of it. I think we should all give him a hand.
Really nice. I think the next one is remote surgery. Like, I'm getting more and more remote, but I'm still connected directly. When it really works is when I can connect from here to maybe Africa or Korea, and they need someone needs a surgery and they want me to do it, and I would connect.
If Dr. Patel could perform 5 surgeries a day, up to 20 a week, and he could possibly do it on a patient in California from Orlando, I'm all for it, as long as they have a backup computer when one doesn't crash.
Morning. Morning.
As you can see, we can go from skin, we get some of the muscle, right down to the vascular system in the bones. And we'll cut the head off, and we'll lower him down like so. This area right here, we have an aneurysm, so we can click that on, make that our center point. We go ahead and hit Q view, and there's your aneurysm right here. Everything that I just showed you there, we did probably in less than 30 seconds. Normally that would take 6-7 hours and a couple of angiograms. And this patient's probably back at work or at home right now.
Today, breakthroughs in medical technology take on many different forms. By combining a working knowledge of anatomy, computer software, and animation, Tom Krakis is able to provide doctors with a three-dimensional, non-invasive way to detect and solve more complex problems.
Your CAT scan, when it circles around you, it takes a slice out and turns it sideways, like a loaf of bread. We have multi-slice detectors on these scanners, so when it goes around once, it actually cuts you 64 times. The computerized technology allows us to render this 3D image.
From a single workstation, Tom Krakis is able to post his discoveries on a computer network that serves the 6 hospitals and 50 locations that form the Adventist Kettering Health System around Dayton, Ohio.
At the turn of the previous century, Charles F. Kettering was one of the most gifted inventors. He had more patents to his name than anyone else other than Thomas Edison. Innovation in technology is an integral part of what Charles F. Kettering was all about. He was always looking for answers to problems that technology could solve.
This patient is about to benefit from advanced imaging. He has an aneurysm of the aorta that can be life-threatening.
And if it suddenly ruptures, he's going to lose all of his blood into his belly in a matter of a few minutes. And more than half the time, he'll just die on the spot before he can get medical care.
Well, the only way to treat this before we head to the angiography suite would be to just open him up and do a major surgery. That would have a large incision that could take weeks, maybe months to recover from that. And if we can do this all through just a catheter, he could actually go home later today. That's pretty amazing. William, we're going to take a picture of you to not breathe. Hold very, very still.
But before the procedure begins, Dr. Schwartz maps out his strategy with the use of 3D imagery.
With the 3D modeling, it really helps us plan what to do with the patient. And a lot of times, it can cut down on other procedures and unnecessary work.
I have physicians that tell me when we do the 3Ds, they're excited because they can now be far more precise. And when you see them concentrating on that image, their foremost element of mind is you do no harm.
There's your diameter just beneath the renal. Save that.
So what he's doing directly impacts the care of the patient and what decisions the physician's ultimately going to make about their care.
We can be better than that. It's fun and you're helping people. It's great.
The unfortunate thing about heart disease, and with the majority of patients I see, that this could be completely prevented with proper education and changes to lifestyle. When patients come in and I start talking to them about their lifestyle, at first when I go in and talk to them, the first thing I say to them is, I won't ask you to do anything I don't do myself. And they breathe a big sigh of relief, thinking, oh, that won't be so bad. And then I start telling them that I'm a vegetarian, I run 6 miles at least 4 days a week,